Sophia Elena reporting outside Senator Feinstein's office in Santa Monica, California, where protesters have gathered in support and in opposition of the healthcare bill. How did you find out about this event?
I got an email from the Obama people.
Okay, I'm a volunteer with Organizing for America, which is sort of what Organizing for Obama morphed into to get people in the campaign. And we're about supporting the president's agenda and trying to move it forward.
You can't talk? Okay. Well, how did you hear about this event?
We actually heard about it through Facebook, Organizing for America. We had people calling us in, letting us know that the teabaggers, if you will, that's the name they gave themselves, were coming here to stage a protest.
Yeah, I'm with Organizing for America, California. I'm a community organizer down in the Long Beach area. And we asked all of the people we know to come here today because we were expecting a large contingent of the opponents to healthcare reform to come here and be disrupted.
You don't want to because you're organizing, or because you're organizing?
Because my communications director doesn't want me to, because you guys aren't official press.
And it's all kind of it's really grassroots. So people are just coming because they want to make sure that folks understand that there's more than one side to this.
I came with my daughter and my husband, but he's a cop, so he's not allowed to be political, so he's not standing next to me.
Who made your sign, ma'am?
I made my sign. Can you tell? It's not very good.
Did you make your own sign?
No, I got the sign here.
Can we see your sign again? Who made your sign?
I don't know. Someone gave it to me.
And who made your sign, sir?
Well, this would be Organizing for America, the organization I just spoke of that is funded by the DNC.
So you came here on your own?
Yes.
Who made your sign?
I did.
Did you come here with anyone, or are you here by yourself?
No,
were you sent here?
With my daughters.
Mm-hmm. So no high-powered congressman or high-powered CEO sent you here? Who made your sign, ma'am?
I did.
Did you come in on a high-powered corporate bus?
We're just housewives who care.
I'm a small business owner.
Yeah, who made your sign?
I'm a small business owner, but the union did not make my sign.
I think they're astroturf. You be the judge of carrying swastikas and symbols like that to a town meeting on health care.
Did you make your own sign?
I did make my own sign, and you can see why I'm angry, because I feel like the American people are being demonized right now. We've been called Nazis. They keep using this slang regarding homosexuality, the teabagging slang, and it's just, nobody's denouncing it. Nobody on the Democratic side, and I'm upset at the Republicans too. No one's standing up and saying this is wrong.
Yeah, who made your sign?
Oh, it's from change.org.
Who made your sign?
Pardon?
Who made your sign?
I did.
Did you make your sign, ma'am?
Yes, I did.
Did you make your own signs?
Oh yeah, we made our own signs.
Who made your sign?
Who made my sign? I made my own sign. All right.
Are you then in support or opposing the healthcare bill?
Support of healthcare. I'm in support of the public option. We need healthcare reform now.
So we're here to support the president's 3 principles for healthcare reform, which are affordability, costs have to be reduced, universal access to the physicians, and coverage for all.
I just want to tell you the truth. This is not about health care, it's about government control.
To reduce cost, to ensure choice, meaning if you like what you have, you keep it, and the one that seems to be causing the most problems for our opposition here, provide quality health care for all.
Because if it was about health care, there would be no rush. We could calmly talk about issues, but there's this massive rush, and I suspect it's because A, they're afraid we'll read the bill, or B, he's afraid the power will shift when we all vote out the liberals.
We need to reduce costs, we need to ensure choice, and we need to provide quality health care.
So you don't support the bill?
I don't support the bill. I do support health care reform, but I don't support a bad bill.
Do you support health care reform?
Yes, of course, yeah.
Have you read the bill?
Not all of it.
I think 90% of the people standing here on this corner, or all 4 of these corners, and in this country want health reform. There's a lot of problems with our healthcare system, but there's a lot of things you can do without throwing out the baby with the bathwater. 85% of people love their health care, so you need to address the issues that are the real problem. First of all, you have pre-existing conditions. That needs to be addressed. You have portability, so that means if you switch jobs, you got to be able to take your health care insurance with you. Pre-existing conditions, that's not fair right now. And opening up the state borders and allowing more competition from other states. You can purchase your own health insurance across state lines, which will lower the costs also. There's 4 things they can work on in Congress without throwing out everybody's private health care.
Sir, can we talk to you for a second?
No.
Okay.
Sounds like you have some things to say.
No, it's just a lot of people out here that don't know facts.